Calgary switch brief.
Madam Speaker, the Health Minister continues to mismanage our healthcare system.
No.
The PC government broke their promise with physicians after the election by tearing up their agreement in principle, and now we're on the warpath against doctors asking for a $275 million cut. When a typical family physician takes in $175,000 after their overhead fees, senior vice presidents like the VP of People and Partners make up to $155,000. So will the Health Minister show some leadership and be asking AHS managers like the VP of Linens to show an example?
Well, Mr. Speaker, I believe that question was answered last week by Alberta Health Services when the board announced a $35 million initiative to reduce executive expenditures and salaries across Alberta Health Services. Madam Speaker, this is exactly the kind of leadership that we're looking for. It's exactly the kind of leadership that agencies, boards and commissions that work under this government are delivering, and it's exactly the kind of advice the honourable member should listen to.
Patience before bureaucracy.
Here, here, here.
Given that the Deputy Minister of Health makes $364,000, and given that the junior vice presidents make up to $220,000, does the Health Minister believe that these bureaucrats have a higher value to patients on the operating table than our doctors do?
Madam Speaker, I don't know what figures the honourable member is quoting from. The Deputy Minister figure certainly doesn't sound correct to us. But putting that aside, Madam Speaker, this province spends more on health care on an age-adjusted basis than any other jurisdiction in the country. This province provides physician compensation that is 14% above the national average. Madam Speaker, it is absolutely true that there are ranges and disparities within physician compensation depending upon which specialty we're talking about, and that's exactly one of the issues we're working on with the AMA.
Executive salaries and bonuses, Madam Speaker. You should know about that. Given that this government recently gave themselves an 8% pay raise and gave their own Deputy Minister a pay hike in June, will the Health Minister commit to cutting these salaries before asking our frontline healthcare workers to take a hit?
Madam Speaker, this government supports a health system that is second to none across the country. The compensation that we provide both to physicians and other providers of services is comparable to any other of the best-paying jurisdictions in the country. Madam Speaker, I don't know what the honourable member is trying to do here in terms of an analogy or a comparison. It doesn't add up to me. It's not an apples-to-apples comparison, and it contributes nothing of value to a discussion about how to improve health care in this province.
The honourable member for Fort Saskatchewan, Vegreville.